The Department of Public Health and Human Services is pleased to bring you Aging Horizons. Medicare, Medicaid, Social Security, fraud, legal issues, veterans benefits, and caregiving. Aging Horizons is a program dedicated to inform and prepare Montanans on these timely issues, making a difference to you and your loved ones. Here now is today's program host.
Hi folks, and welcome to Aging Horizons. On today's show we'll be talking about Medicare more in depth. We'll be talking about SHIP counselors, state health insurance and assistance program individuals who are throughout the state, available through an 800 number or in person, that can help you with anything related to Medicare. They can help you sign up if you have questions, if you want to change your plans. We'll talk about that and a lot more about Medicare, so stay tuned.
Every 65 seconds, someone is affected with Alzheimer's or other dementias. Many become isolated at a time when help is most needed. If you or someone you love is affected, help is available, both for people with memory loss and their caregivers. Memory loss can feel frightening, but you are not alone. Call the free 24/7 Alzheimer's Association helpline, 800-272-3900, for guidance and support.
Medicare loses $60 million in Montana each year, $60 billion nationally. Medicare processes 4.5 million claims a day. They don't know who your doctor is, but you do. Mistakes can happen. Read your Medicare statements and call Montana Senior Medicare Patrol if you see anything unexpected. 1-800-551-3191. This project is supported by a grant by the Administration for Community Living.
I've been shooting since I was young. It's something I've always enjoyed. I wasn't feeling like myself, when my friend noticed. He asked if he could hold onto my guns temporarily. At first, I was a little shocked, but then I agreed. I think he saved my life that day.
45 years, 2 packs a day. It's like $80,000. I thought I was just hurting myself until I fell asleep in a chair with a cigarette. The whole house went up. I lost it all. I knew smoking was expensive, but I never thought it would cost me everything.
Hi folks, and welcome to Aging Horizons, brought to you by the Department of Public Health and Human Services Senior and Long-Term Care Division. I'm your host, Brian Lamore. We're discussing today Medicare, and what we're going to focus in on is the individuals that will help you locally understand what it is, any issues you have, or any questions, or possibly any fraud. Those are called SHIP counselors. They're available statewide, and we'll have an 800 number and a website down below so you can contact them. But they're there to help you. That's what's important. So joining us from the Missoula Aging Services is Chris Hightower. You're the Resource Center Supervisor. Welcome to the show, Chris. It's great to have you here.
Yes, Brian, thank you for having me. I'm excited for this opportunity.
Great. Well, you know, the SHIP Counselor, State Health Insurance and Assistance Program individual, what is this program and what is it designed to do? How does it help our Montana citizens?
Yes, great question. So, SHIP counselors, our main goal is to provide no-cost health benefits, counseling, and advocacy for Medicare beneficiaries and their families or caregivers. Mm-hmm. So essentially, we get quite a bit of training in the Medicare world, in the Medicaid world, and other health benefit counseling. So we're trained quite a bit to offer counseling on Medicare and Medicaid. And my favorite part about the whole program is that we get to offer a non-biased view and counsel on Medicare and Medicaid. So meaning, like, we're not insurance agents. We don't get any kickbacks from insurance companies. Our job, if we do it well, is to educate folks and empower them to make their own healthcare decisions and feel good about it. Mm-hmm. Yes.
Yeah, and what I like to say is they don't have anything on the shelf to sell you. So now, how does you have a population, it's the Medicare population. Let's define that for our audience. Who are Medicare recipients?
Yes. Medicare recipients are folks that are 65 and older, or on Social Security disability that are under the age of 65. Yeah.
Okay, and there's the Medicare insurance policies. Insurance program has Medicare A, B, C, and D. Could you please really just quickly define what those are for our viewers?
Yes, I'd love to. So Medicare Part A is your hospital insurance. So let's think inpatient status here. And so with all health insurance, there are deductibles, there are co-pays, and there are co-insurances for stays in the hospital. And we like to say a Medicare qualified visit. So that's your Part A is hospital. And then your Part B, let's think outside the hospital, any outpatient services. So appointments like primary doctor's visits, going to specialists, durable medical equipment, physical therapy, those kind of things. Yes. And we'll talk about here in a little bit, there are some costs that come with your Part B, especially the premium, which is $185 a month. So we'll have a great opportunity to talk about how to get to see if people qualify for coverage for those costs. And then there's Medicare Part D, also known as a prescription drug plan. So this is just your drug coverage, nothing else. Mm-hmm. And these plans we like to look at with folks. We use the tool of Medicare.gov. It's a very intuitive tool. It works very well. And that's kind of how we help folks navigate Part D. And then there's Part C, commonly known as a Medicare Advantage plan. Those kind of wrap everything I just talked about into kind of one pretty little plan. It includes your Part A hospital coverage, your Part B medical coverage, and then also drug coverage. So yeah, that's kind of the, in a nutshell, scope of your Medicare options.
Okay, and I guess the SHIP counselors become pretty busy at the end of every year because that's a Medicare re-enrollment period where an individual can decide, is this plan that I've signed up for meeting my needs? Do I need to get a better plan or maybe a lesser plan? And you guys, the SHIP counselors, are the ones that really help out, don't you?
Yes, we do. That is our busiest time of year, actually. We, between the months of October 15th and December 7th, that is our bread and butter. We have appointments all day long working with individuals to help them review their Medicare prescription drug plans, Part Ds, and their Medicare Advantage plans if they have a Medicare Advantage plan. So during those, we get to sit down with folks. We use Medicare.gov, like I had said, and we get to just walk through the process of enrolling, reviewing the plan, and we really encourage folks to do that because prescription drug plans and Medicare Advantage plans can make changes to how they cover medications, what the premiums are, deductibles may change, so we get to inform people of these changes and then be a part of the process of them selecting which is the best plan for them for the upcoming year.
Okay, now we've drawn to a quick close on this first segment already, but we got a lot of baseline information. But what's important to the SHIP counselors also, you get these Medicare explanation of benefits, if you have any questions on that. Many times if an individual is on Medicare, they do have some health issues, and possibly another person you would want to help you, maybe your accountant, attorney, maybe your son, daughter, or a friend. They're more than welcome to help you out in talking with a SHIP counselor. Now in the next segment, we'll also be talking about some programs we call as helping programs. These programs, if you're eligible, they have different eligibilities, which a SHIP counselor can help you with, can help pay some of your Medicare premiums. So we'll talk about that and so much more. Stay tuned. We'll be right back.
You've probably seen some big-name celebrities on your TV lately talking about all the Medicare benefits you're missing out on.
But the insurance companies who are paying for these ads may be pushing benefits not available in Montana. Fortunately, help is available from a friendly state health insurance assistance program counselor who can help you sort it all out. It's free, and we screen everyone for eligibility regardless of your zip code. It's Montanans helping Montanans. Call today.
Did you just text me?
I didn't want to disturb you if you were sleeping.
Sleeping? I'm sitting right next to you, silly.
There you are. Hey, I found a couple of Medicare helping programs online that I think we ought to look into.
It says if we qualify, we can get help paying for our prescription drugs. Oh, and there's a program that can help pay our Part B premium.
To learn more about extra help and Medicare savings programs, call your local SHIP counselor today.
Maybe I better text him.
A message from FireSafe Montana. With the large number of homes being built in the wildland urban interface, it is the responsibility of the homeowner to use ignition-resistant materials. Many buildings in a wildfire are burned from the roof down. Consider using a metal or asphalt roofing material. The siding of a home is subject to extremely high heat during a fire. Look into the use of stone, stucco, or cement board. Contact FireSafe Montana for more information. This message brought to you by FireSafe Montana and aired by the Montana Broadcasters Association.
Hey caregivers, did you know that respite time is your time? How will you spend it?
We love to get outdoors, so if we have any free time, that's pretty much where you can find us.
Bailey Tolson, East Helena.
We love to hike. Any chance we get, we're out there. And of course, there's always date night.
Montana Lifespan Respite. Respite for caregivers. It's okay to need it. It's okay to want it. It's okay to get it. To learn if you're eligible, call 1-800-224-6034.
We love date night.
Hi, folks, and welcome back to Aging Horizons. I'm your host, Brian Lamore. We're continuing our discussion about Medicare, and you. We're talking about our SHIP counselors throughout the state that are available to help you figure out any problems, any issues, or any questions that you might have. Rejoining us is Chris Hightower with Missoula Aging Services. He's a Resource Center Supervisor. And Chris, I've mentioned earlier about special programs that can help an individual pay for their premiums. Let's go over those. What are those programs?
Yes, Medicare savings programs specifically, these are my favorite. As we know, Medicare, they have premiums for their services, and in particular, the Part B premiums, $185 a month. That's a lot of money when you're on a fixed income. So there are some helping programs through the state of Montana and distributed by the Office of Public Assistance that can help with these premiums, and specific programs that help with healthcare coverage. So yes, I'd like to get into those a little bit here. The first one that comes to mind is the Qualified Medicare Beneficiary Program. This program is kind of the cream of the crop here. Their income limit is 100% of the federal poverty level. They pay for the Medicare Part A and Part B premiums. They offer additional health care coverage. So this kind of acts as a secondary, if you will, to your Medicare Part A and Part B coverage. So the application process is something that we help folks with here at Missoula Aging Services, and we can help folks apply. The next level of a Medicare savings program is called the Specified Low Income Medicare Beneficiary, also known as SLIMB. This program just pays for the Part B premium. The income limit is a little bit higher for this program at 120% the federal poverty level. And then the next one is called QI1, Qualifying Individual. This one has the highest income limit to be able to qualify for a Medicare savings program at 135% the federal poverty level. So this program, again, pays for the Part B premium. And again, that's $185 a month. So that's kind of my favorite, because being able to save folks that money is a big deal. Mm-hmm. And then there's another Medicaid program called Qualified Disabled Working Individuals. This is for the folks who are under 65, who are working, who have a disability and are not Medicaid eligible. It helps them pay for their Part A premium, and another great program.
That's great. And you know, these programs, as you mentioned, they have different qualifications to be eligible for them. You can be eligible for one, maybe more. Now, people can go to a website and might see the one program, look at it and say, I'm not eligible, but that doesn't mean you're not eligible for all the programs, right?
That's very true. So that's, again, a bonus of sitting down with a SHIP counselor to go over these things, because during these appointments, we get to screen folks, if you will, for all these different programs. We ask them questions about income, about assets, and then we can screen for these programs and help apply for any that they qualify for.
Mm-hmm. And I think an important aspect of this too is that you're through an area agency on aging. Now we're talking about Medicare health insurance, but the area agency provides a lot more services, and the SHIP counselors can hook them up to those. Well, let's briefly kind of go over some of those. We'll talk more about them in the next segment, but let us know.
Yes, so I'm going to keep in the line here of helping programs with Medicare costs and prescription drug costs. So another important program that we like to talk to folks about is called Low Income Subsidy, also known as Extra Help. This is a federal assistance program that helps pay for Part D premiums and lowers co-insurance charges or co-payments for covered medications. So this program is administered by the Social Security Administration. There are its income and asset guidelines. They work with both Part D and Medicare Advantage plans. So it can also help help folks with late enrollment penalties. It can get rid of those. So this is a big one. It can really help lower the cost of medications. It can make premiums as low as $0 a month. And because I think we know some medications out there are quite expensive. So this is a good one.
Okay. And also, if an individual is on Medicaid and they become Medicare eligible, Medicaid wants to help out also, right?
Yes, they do. So there's a transition period for folks that are transitioning from Medicaid to Medicare, and sometimes there are programs that we need to make applications for. So it's not a time to hesitate on making sure that your healthcare benefits are in line during that transition period.
Mm-hmm. That's right. And we're on to a close so quickly on our second segment. But I think what we've illustrated here with you, Chris, is that there is some complexity here. Sometimes people on Medicare, they need a little help in figuring these out. Now, you don't decide for the individual. You'll give them all the information that they need so that they can make their own decision. And you also welcome other individuals, say their attorney or maybe their accountant or family member. You're more than happy to work with everyone to make sure they get on the right plan, right?
Yes, that's exactly right.
That's great. Well, ladies and gentlemen, in our next segment, we'll be talking more about what Missoula Aging Services gives to the community, which is replicated throughout the state. So stay tuned.
Can you say ombudsman?
Ombudsman. Benson?
Uma Doodlesman? Fortunately, you don't have to say it right to get the help of a long-term care ombudsman. If you or a loved one reside in assisted living or long-term care, an ombudsman can help resolve any issue. And these services are completely free and confidential. Now, why don't you try that again?
Ombudsman.
I was the last guy you'd expect to get diabetes. I was a competitive runner and I always took care of myself. So when I was diagnosed, it kind of threw me. But it's really encouraging to know I'm not alone with it. There are a lot of other people going through the same things as I am. It takes some effort. You have to keep after it. Exercise, meds, and diet are the key. But there are a lot of folks who want me to succeed. Diabetes is not the end of the world. With effort and attitude, you can have a normal life.
I think the most pleasant surprise when we turned 65 and signed up for Medicare Part B was finding out about our Welcome to Medicare preventive visit.
It was free, and it gave us the opportunity to visit with our doctors and establish a plan for our health going forward.
They reviewed our medical history, measured our height, weight, blood pressure, and counseled us on other risk factors.
To learn more about Medicare's free or low-cost preventive and wellness benefits, call your local SHIP counselor at 800-551-3191. I mentioned it's free, right?
Twice.
Elder abuse is a growing problem, and it's happening right here in our Montana communities. At least 1 in 10 older adults are victims of physical or emotional abuse, financial exploitation, or neglect. To get help or report elder abuse, call your local area agency on aging or Adult Protective Services at 1-844-277-9300.
Welcome back to Aging Horizons. I'm your host, Brian Lamore, and we continue our discussion about Medicare. And we left one program out from the last segment, is the program that can help you pay your premiums. And Chris is going to tell us all about that. Tell us more, Chris.
Yes, Big Sky RX. I'd love for everyone to know about this one. Here, Big Sky RX is a state-administered prescription assistance program that helps Medicare clients pay for Medicare-approved prescription drug insurance premiums. So this one is kind of for the folks that do not qualify for extra help. They may be over income. There's a higher income requirement for Big Sky RX. They don't help with the cost of prescriptions per se in the form of co-pays or co-insurances at the pharmacy. They do help with the premiums. And that premium is up to $50.60. The state-funded program can pay towards Medicare Part D premiums, or if you're on a Medicare Advantage plan that has a drug premium attached to it. So this program is for Montana individuals who live in a residence of Montana. They must be a Medicare recipient. There are some income guidelines here. They must have income less than $31,300 for a single person, or $42,300 for married folks living together. And a really great part about this program is there is no asset limits.
Okay, that's great. Well, now, Chris, you're a part of what we call the Area Agency on Aging network throughout the state of Montana, Missoula Aging Services. Tell us about what an area agency does, how it represents seniors, and how it benefits them.
Yes. Here at Missoula Aging Services, we're one of 9 agencies on aging offering information and assistance across the state. We're an aging and disability resource center that can provide resources, information, referrals, and assistance to older adults, adults with disabilities, and their family and caregivers. I'm a part of the information and assistance department. Myself and the resource team here, we are all SHIP counselors, and then we help with quite a few different things. So a lot of what we do is new to Medicare. That's a big piece. We help people who are new to Medicare understand their benefit and understand their options. We help folks with general eligibility screenings. We call them resource benefit screenings. There are appointments where we sit down with folks, ask questions about income and assets, and screen for everything for all kinds of assistance programs, because our big goal here is to see how we can make folks, their money go further. We want to save people as much money as possible because, like I said, a lot of folks that we meet with are on fixed income. So saving some money anywhere we can is a good deal. Mm-hmm. We also help with caregiver consultations. We sit down with folks in caregiving roles and talk about resources. We help with long-term care planning and can help folks apply for long-term care Medicaid. So that's kind of the level of Medicaid that folks use to get into an assisted living facility or a nursing home. So we can help navigate that process. But what's coming up right now, and I'd like to highlight, on August 15th begins the period where property owners who pay property taxes can file for the property tax rebate. And we help quite a few folks do that process.
Mm-hmm. Great. And the area agency also, I know, provides senior center services, Meals on Wheels, and ombudsman services. Please define what those are for our viewers.
Yeah, awesome. The ombudsman program they're the voice and advocate for folks living in an assisted living facility or a nursing home. So they're the boots on the ground, talking to residents and making sure that their rights are respected and upheld in these living quarters. Another big program is the Meals on Wheels program. That is housed through Missoula Aging Services here in Missoula. This program is wonderful. We have quite a few folks living in Missoula, often in more or less isolated situations, and they're able to get a hot meal Monday through Friday, and then also have the option to get a frozen meal for dinner. So this program is big because it offers some social interaction. These folks get to chat with their Meals on Wheels driver. They get to have an interaction and then go about their day. So we're big fans of the Meals on Wheels program. Our whole nutrition team is wonderful. They work very hard to make sure that folks are receiving social interaction and also a nutritious meal.
Okay. Yeah, that's great, Chris. We're trying to close on this segment so quickly, but I'll mention that the senior centers in your local communities offer social interaction too and a good meal. Chris, thank you so much for being on the show. You're a great representative of the Medicare system and all the caring people that are through our area agencies that are helping out seniors throughout the state. And for our viewers, a quick reminder, the Medicare SHIP program helps individuals figure anything out about Medicare. Open enrollment is coming up pretty soon, the end of the year, and you'll be able to choose whether your program is helping you or not, or if you'd like to change. The SHIP people, with the numbers that have been on the screen, are there to help you with anything you need. Any question on Medicare, any question that your loved ones might have, or the possibility that there might be fraud. They can look into that too. But I want to encourage anybody with any question on aging, whether you're a senior or you care for a senior, give the 800 number a call, and they have a program and a person there to answer your questions. For Aging Horizons, I'm Brian Lamore. Thank you for joining us.
Special thanks to the Department of Public Health and Human Services for their continued support. Hosts on Aging Horizons are program specialists at the Montana Office on Aging. Production facilities provided by Video Express Productions. For more information about Aging Horizons, call the Department of Public Health and Human Services toll-free at 800-332-2272.